Good morning, I'm Rose Lee, and today we'll discuss how to take a proactive approach to finding a mindful attitude if you're diagnosed with a serious illness. Now listen up, because we have national experts who have resourceful information on advanced treatments and commonsensical lifestyle tips to keep you healthier. When legendary singer Patti LaBelle learned she had diabetes over 20 years ago, she thought that meant no more fun in the kitchen. A thought that's shared by many of the 1.5 million Americans diagnosed with diabetes each year. Joining us today to discuss ways to live well with diabetes is music legend Patti LaBelle and nutritionist and author Liz Ward. Good morning, ladies.
Good morning.
Good morning.
Patti, may I start with you? We work together on creating diabetes awareness for many years now. And
Yes.
you always tell me how blessed you are to sing and give people such joy just listening to your beautiful voice. How do you bring that joyful energy to motivate healthy eating to those recently diagnosed with diabetes?
Well, I tell them my story. You know, I've been a diabetic for 20, maybe 23 years, I don't know. And I found out by accident. And I always say to people, really, I didn't go to the doctors as much as I should have, which was my fault. And I never knew what my blood sugar was. And when I passed out on stage thinking I was exhausted, he said that your blood sugar is so high, you are type 2 diabetic. So I had to stop frying the chicken. I had to stop using all that oil and all that stuff and eating all that cheese on the pizza. And I learned how to live better by, I know how to monitor my recipes and make them very good for me. And they taste the same as the other stuff tasted before I was diagnosed.
All right, Patti, so what lifestyle changes did you make that got you on the road to living a more mindful lifestyle?
Well, when I left yesterday from Philadelphia, I made my own sandwiches, my turkey sandwiches with the lettuce, tomatoes, and onions, and a great sandwich. And when I cook in hotels, I usually take my pots and pans on the road, and we find a farmer's market, and I have dinner made, in like 15 minutes with some branzino and some sauteed spinach and lettuce and tomato salad, and you can live well, and the food tastes much better than room service. And I know how to cook.
Without a doubt.
I'm serious, I'm not
I
lying.
bet you. All right, Liz. As a registered dietitian and author of several healthy eating books, what tips can you offer our viewers with diabetes to eat more mindfully?
Well, the first thing you need to do is visit with a registered dietitian. I'm a big fan of that because that person can tailor an eating plan that's right for you. Everyone is unique, so they need to know how to do this. But really, most people need to cut calories and they need to cut back on carbohydrate and sugar. So one of the things I do recommend is using healthy substitutes like the Hood Calorie Countdown beverage because it's got much less sugar, fewer carbohydrates, and fewer calories. So what you can do is use that on a daily basis in your coffee, in your cereal, and also in your cooking. And this is something that Patti has done and has really enjoyed. We have proof right here.
And we have fun in the kitchen. It's not boring, being a diabetic. It's fun. And you create so many different dishes, during the day, which I do. And like the Hood Calorie Countdown has helped my life a lot, in the macaroni and cheese, and the peach, all these beautiful shakes, the oatmeal and pumpkin muffins, the overnight oatmeal.
Yeah.
It's just so many other things that you use the beverage in. And I'm blessed to be a part of this Hood Calorie Countdown.
Okay, so share some of those easy recipe tips that you both, of course, had my interest when you were on the pumpkin muffins.
Yeah. So the pumpkin muffins are made with the Hood Calorie Countdown beverage, but also with a lot less sugar and a lot more fiber. And those are all the things that you want to keep in mind with a diagnosis of diabetes, but also you don't even have to have diabetes to enjoy these foods. I mean, they're good for everyone in the family. And we have so many recipes on the website, hoodcaloriecountdown.com, that use the beverage and have much less sugar and much less carbohydrate and calories than maybe the typical muffin.
All right, what recipes can you suggest that are traditional favorites that you can serve during and after holidays and all year long?
Well, Patty, mac and cheese, she's mastered it. She's definitely mastered that.
Yes.
Certainly these pumpkin muffins are good. But, you know, really anytime that you're using cream, you can use the
beverage.
calorie countdown beverage. And, you know, any place that there's milk being used or a cream, as I said, like in a soup, like in a creamy soup, go ahead and use
the beverage.
Use the beverage and you'll get, you know, fewer calories, less sugar, fewer
Yes.
carbohydrates, and great taste.
And you can go to hoodcaloriecountdown.com to find out much more stuff.
Thanks, Patty and Liz, for sharing resources that can help all of us take a more mindful approach every day to a healthier life.
Yes.
Thank you.
Bye-bye.
Many healthcare professionals say the evolution of the Affordable Health Care Act drove the cost of healthcare up instead of down. One of the most newest models being promoted by some physician groups as an option for patients to save money and access affordable quality healthcare is called Direct Primary Care, or DPC. This model offers primary care services at a fixed monthly fee through a contract between a patient and a physician provider. This primary care model is offered in 24 states to those with high deductible health insurance or no insurance at all. Here to explain the benefits of DPC is healthcare professional Joseph DeCapua. Good morning, Joseph.
Good morning, Rosalie. How are you doing?
I'm fine, thank you. So, Joseph, is direct primary care a form of insurance?
No, Rosalie. Direct primary care is not a form of insurance. There's a distinct difference between the two. One is health insurance, which is through a company, for example, Aetna, Humana, Coventry. That's health insurance where the plan offers all the services, medical services that you would need to be covered. Hospitalization, specialists, diagnostics, lab, rehab, pharmacy. So all those are covered underneath health insurance. Direct primary care is based on a membership format whereupon a patient and a doctor, primary care doctor, sits down and they contract services.
All right, what's the distinction between health insurance and direct primary care?
A hospital is not covered under direct primary care. The doctor offers a list of primary care services that the patient would receive for a fixed amount, monthly amount, which is usually between, depending on the age, $45 to $125 per month.
If a person cannot afford health insurance, will direct primary care provide services that most health insurance policies offer?
Direct primary care only offers primary care services, and people have to remember that 70 to 80% of their medical needs can be met by a primary care physician. A hospital is not covered under direct primary care.
All right, so if there was a hospital visit, it would not be covered under direct primary care?
A patient that has health insurance can go to the ER if they want. Someone with a direct primary care would call the doctor, and the doctor will then assess over the phone what could be done, whether the patient should go to an urgent care center or to the ER.
All right, Joseph, now walk us through the patient-doctor relationship and how it works through direct primary care.
The patient comes in, they speak to the physician, they sit down, and the physician then takes out the contract and they go over the services that are offered underneath this membership agreement. And when the patient decides that, yes, they want to become a member, they then sign up. Usually there's a processing fee. It depends, anywhere from $25 to $75, a one-time processing fee. And then there is the membership fee that's a monthly fee. And again, that is age-related in age ranges. Most doctors do not see Medicare because they do not want to, what we call, opt out of the Medicare program. The program for direct primary care usually stops at people at age 64. One of the benefits of direct primary care for seniors is that usually when the spouse hits 65 and becomes Medicare eligible, that person's spouse does not have insurance and loses insurance. Using direct primary care, they're able to get some type of health care.
If a single mother with 3 children cannot afford health insurance for her family, is there a family plan membership available?
Yes, there is, and it depends on the direct primary care practice that you go to. Some practices have pediatricians or family physicians that would see newborns and up, but most of the practices for primary care have family practitioners that will see from 16 and up, or internal medicine doctors that will see from 18 and up. So the answer to that is it depends on the direct primary care practice itself.
Thank you, Joseph, for joining us this morning to share the new healthcare service model for those who need healthcare coverage and access to a primary care doctor.
Thank you, Rosalie. I appreciate it.
Are you committed to stay active and on the go with your family like I am? Well, then you need to be aware on how to avoid spreading disease. The Center for Disease Control has a healthy reminder. Michelle Halavasa is an epidemiologist at the CDC with an important health reminder that will help stop spreading disease.
Hand washing is one of the most important ways you can keep from getting sick and spreading germs to others. Dirty hands spread disease. This hand washing demonstration will show you how hand washing can get rid of germs and chemicals that get on our hands every day. This gel is like the germs and chemicals that we get from things we touch throughout the day, like our toys and pets. If we then rub our eyes, nose, or mouth, or pick up something to eat, the germs or chemicals can get into our bodies and make us sick. Studies have shown that people touch their eyes, nose, and mouth about 25 times every hour without even realizing it. To get rid of these germs and chemicals, CDC recommends you follow these easy steps every time you wash your hands. Wet, lather, scrub, rinse, and dry. We're going to show you the right way to do each step. First, wet your hands with clean running water. Turn off the tap and apply soap. Then, lather your hands by rubbing them together with the soap. Be sure to lather the backs of your hands, between your fingers, and under your nails. Scrub your hands for at least 20 seconds. If you don't have a clock nearby, keep scrubbing until you've sung the happy birthday song twice. Rinse your hands well under clean running water. Dry your hands using a clean towel, electric hand dryer, or air dry them. Washing your hands using the steps we just demonstrated is very important to get hands completely clean. Let's see how well we got rid of the germs and chemicals. Why is this so important? Germs and chemicals from unwashed hands can get into our foods and drinks when they're being prepared or when we're eating or drinking them, which can make us sick. Also, germs and chemicals from unwashed hands can be transferred to other objects like cell phones, tabletops, or toys, and then transferred to other people's hands. That's why it's so important to wash your hands following these steps. Wet, lather, scrub, rinse, and dry, so you can stay healthy and help keep those around you healthy.
For more information, visit cdc.gov hand washing. Over the last 2 decades, the number of Americans with kidney cancer has risen each year. In 2018, approximately 63,000 new cases of kidney cancer was diagnosed in the U.S., with an estimated 15,000 deaths. The most common type of kidney cancer is renal cell carcinoma, or RCC. It accounts for 90% of all adult renal malignancies and generally affects people between the ages of 50 to 70 years old. Those affected by advanced RCC have reason to feel hopeful due to recent new scientific advancements. Joining us this morning to discuss new treatment options available to some patients with advanced kidney disease is Dr. Sabby George, an associate professor of oncology at the Roswell Park Comprehensive Cancer Center, specializing in the treatment of kidney, bladder, and prostate cancers, alongside with Dina Battle, the president of the Kidney Cancer Research Alliance, KC Cure. Good morning to both of you.
Good morning.
Good morning.
Thank you for having us.
Doctor, tell us about renal cell carcinoma and how is this type of cancer diagnosed?
Renal cell carcinoma, or the commonest type of cancer in the kidney, which is a fatal disease. This could grow into a big tumor in the back of the abdomen till it is found out. So it could evade the finding of a tumor in the back of the abdomen for a long time. The commonest type of symptoms or signs include flank pain, blood in the urine, or a tumor or a mass in the back of the abdomen on palpation or examination by the doctor. So these are signs and symptoms of kidney tumors, and that's how it gets started or it gets investigated initially.
Research shows when kidney cancer is diagnosed at an advanced stage, almost 8% of patients live beyond 5 years, and their prognosis is even worse in patients with certain risk factors. What are those risk factors?
So there are risk factors used for classification of patients into risk grouping. There are two main types of risk grouping. One is called the IMDC database risk grouping or prognostic scoring system. And then the other one is called the MSKCC risk grouping. These are some factors which are changes in the blood test or changes in their functional status, and also the recurrence of the tumor after having the primary surgery for removing the kidney tumor. So these are basically broad classification of risk grouping, and they get grouped into favorable, intermediate, and poor risk based on the number of factors that they have. And then the outcome also varies based on these risk grouping.
Now, Dina, as an advocate, share with us why you started KC Cure and your advocacy efforts.
So the Kidney Cancer Research Alliance, or KC Cure, is a grassroots organization of patients and doctors that came together to increase awareness. It's actually kind of a special story of how we started. I lost my husband to kidney cancer in 2009, and I joined together with Dr. Hans Hammers, who was the oncologist who treated my late husband. And we really wanted to increase awareness and increase research funding and make sure that no other family had to go through what my family had to go through.
All right, Dina, so tell us a little bit about your work as an advocate.
So we work really hard to increase awareness and education about the disease. We also provide research funding to those who are doing early seed funding research in kidney cancer. And we also encourage patients to connect with other people who are dealing with the same diagnosis, just so that they have a sense of community and they can talk to others who are managing this disease.
Dina, how old was your husband when he was diagnosed with this disease?
He was young. He was 40 when he was diagnosed, and it was a really shocking, horrible time for us. And as an organization, one of our hopes is that we can provide some of the educational material that wasn't available to us when my husband was diagnosed. And we're really grateful to industry partners like Bristol Myers Squibb who have helped us to provide that type of material for others who are dealing with this.
So, Doctor, a new combination therapy was approved by the U.S. Food and Drug Administration to treat certain people with RCC.
The recent approval by FDA is a combination of Opdivo and Yervoy, which belong in the class of immuno-oncology drugs. These two drugs together, they can activate the immune system, which is turned off by the cancer. And the immune system goes and fights the cancer. That's how this works. And the trial, Checkmate 214, demonstrated that the combination of Opdivo and Yervoy can shrink a tumor in a higher percentage of patients, as well as can make the kidney cancer patients live longer compared to the standard comparator, sunitinib, on that trial. So this is wonderful data. And also, 9% of patients who were treated with the combination went to what's called a complete response, meaning complete resolution of the tumors that they had.
All right, Dina, so what advice do you have for those living with RCC?
Two big messages. One is stay hopeful. New treatments like this are very exciting and give lots of reason to be hopeful. Two, be educated about your disease. We encourage folks to visit our website, kccure.org, to get more information. And also Opdivo.com is an excellent source of information about this new and exciting combination therapy that's available to patients with advanced RCC.
Thank you, Dr. George and Dina, for joining us this morning to share new cancer treatment options and the support resources that are available to those living with kidney cancer.
Thanks for having us.
Thank you for having us.
Are you aware there are major complications associated with type 2 diabetes when coupled with cardiovascular disease? That is the leading cause of death for people with type 2 diabetes, and it's responsible for approximately 2 out of 3 deaths in the U.S. And I personally know how that is a deadly combination of type 2 diabetes and cardiovascular disease, and how it destroyed my father's life. Here to discuss a new development and what it means to adults with type 2 diabetes and cardiovascular disease is Dr. Christopher Cannon from the Cardiovascular Division at Brigham and Women's Hospital, Boston. And he's also the professor of medicine at Harvard Medical School. Good morning, doctor.
Good morning. Thank you for having me.
How common is cardiovascular disease among people with type 2 diabetes?
Well, cardiovascular disease is the big thing that we worry about as a complication from diabetes. It's often something that can develop in the setting of other risk factors like high blood pressure and high cholesterol as well. But patients who have diabetes are 2 to 4 times more likely to develop cardiovascular disease. And so it's the real big worry of patients who have diabetes.
So tell us, what's the distinction between low blood sugar and type 2 diabetes?
Well, diabetes is actually too high a blood sugar is the manifestation that we see most. On rare occasion, I actually have hypoglycemia or low blood sugar. That's a more rare thing. It can happen in patients who have diabetes who are getting treated because they're trying to lower the blood sugar. Sometimes it can go too low. And that has been really the focus in how diabetes has been managed, is all focused on the blood sugar. But we now have this new indication where we can start focusing on how patients' survival and risk of cardiovascular death. So exciting new developments in this area.
Doctor, discuss new treatments needed for adults with type 2 diabetes and established cardiovascular disease.
Well, there have been therapies available for decades, and despite that, of the people with diabetes who die, 2 out of 3 of them die from cardiovascular disease. And so all the treatments that we have are really not good enough. And there have been some large studies with many of the available therapies, the older therapies, where surprisingly we've not seen lower rates of heart attacks, strokes, or deaths until now. So it's a new era that we're entering.
Tell us more about the new development that received an FDA approval.
So the FDA has just granted approval for a medication called empagliflozin, or Jardiance, that now has an indication for use to reduce the risk of cardiovascular death in patients with type 2 diabetes and known cardiovascular disease. It's actually already been approved for lowering glucose, but this is the first medication to get this indication that it can reduce the risk of cardiovascular death. And so it shifts our focus into the really important things of trying to prevent people from dying from cardiovascular disease.
What research findings help support this FDA approval?
Well, the FDA looked at a large trial that was done. It was over 7,000 patients treated for 3 to 4 years. It was patients with type 2 diabetes and known cardiovascular disease who were receiving all their standard therapies. And then some of them were given the agent empagliflozin. And those patients had a lower risk of cardiovascular death, heart attack, or stroke. But the FDA called attention to a 38% reduction in cardiovascular death with empagliflozin. And so that became the basis of this new indication for use.
Is type 2 diabetes and cardiovascular disease hereditary?
Yes, unfortunately, this is has a genetic preponderance and obviously related also to lifestyle and diet, but many factors go in. Then once a diagnosis is established, I think it is a call for us as doctors and working with patients to try and do good lifestyle changes and various medications control all risk factors we can. And then for this group of patients with known disease, we have a new therapy that could reduce their risk of dying from cardiovascular disease.
All right, Dr. Cannon, where can we learn more?
Well, I think there is information available on the web, but probably it's best a discussion between you, patients and doctor, either the primary care doctor or cardiologist, to see would this fit in and be appropriate for each patient. And so hopefully that can be a way to engender dialogue on this and all the treatments that could hopefully help patients.
Thank you, Dr. Cannon, for sharing new treatments to help save lives for adults with type 2 diabetes and cardiovascular disease.
Thank you very much for having me.
Those who suffer from diabetes, kidney disease, or a compromising medical issue must take on a proactive approach to better understand new treatments and advanced therapies in order to live their lives to the fullest. Scientific advancements and healthcare benefits all of us and are vital to our living a greater quality of life. A positive, mindful attitude is the greatest preventative medicine. Share with us your approach to keep yourself and your family healthy at facebook.com/Rose Lee Show. And follow us on Instagram at The Rose Lee Show. And watch this episode and many others 24/7 at RoseleeArtishow.com. Thanks for joining us, and we look forward to seeing you soon.